Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on fibromyalgia, which is also a very important topic. So, what is fibromyalgia? Fibromyalgia is a chronic long-lasting disorder that causes pain and tenderness throughout the body, as well as fatigue and trouble sleeping. Scientists do not fully understand what causes it, but people with disorder have a heightened sensitivity to pain. There is no cure for fibromyalgia, but doctors and other healthcare providers can help manage and treat the symptoms. Treatment typically involves a combination of exercise or other movement therapies, psychological and behavioral therapy, and medications. Who gets fibromyalgia? Anyone can get fibromyalgia, but more women get it than men. It can affect people of any age, even children, but it usually starts in middle age and the chance of having it increases as you get older. It occurs in people of all racial and ethnic backgrounds. If you have other diseases, especially rheumatic diseases, mood disorders, or conditions that cause pain, you may be more likely to have fibromyalgia. And these diseases include rheumatoid arthritis, systemic lupus erythematosus, commonly called as lupus, ankylosing spondylitis, osteoarthritis, depression, anxiety, chronic back pain, and irritable bowel syndrome. Fibromyalgia tends to run in families, and some scientists believe that certain genes could make you more likely to develop it. However, the disorder also occurs in people with no family history of the disorder. What are the symptoms of fibromyalgia? The main symptoms of fibromyalgia are chronic, widespread pain throughout the body or at multiple sites. Pain is often felt in the arms, legs, head, chest, abdomen, back, and buttocks. People often describe it as itching, aching, and burning or throbbing, and people might feel fatigue or an overwhelming feeling of being tired, and they have trouble in sleeping. And other symptoms might include muscle and joint stiffness, tenderness to touch, numbness or tingling in the arms and legs, problems with concentrating, thinking clearly, and memory, sometimes called fibro fog, and heightened sensitivity to light, noise, odors, and temperatures. Digestive issues are also occurring, such as bloating or constipation. And what are the causes of fibromyalgia? The cause of fibromyalgia is not known, but studies show that people with the disorder have a heightened sensitivity to pain, so they feel pain when others do not. Brain imaging studies and other research have uncovered evidence of altered signaling in neural pathways that transmit and receive pain in people with fibromyalgia. And these changes may also contribute to the fatigue, sleep disturbances, and cognitive problems that many people with the disorder experience. Fibromyalgia tends to run in families, so genetic factors are likely to contribute to the disorder, but little is known for sure about the specific genes involved. Researchers believe that environmental non-genetic factors also play a role in person's risk of developing the disorder. These environmental triggers may include having a disease that causes pain, such as rheumatoid arthritis, or mental health problems such as anxiety or depression. Now, we would come to the diagnosis, treatment of fibromyalgia. About the diagnosis of fibromyalgia, fibromyalgia is diagnosed based primarily on having pain all over the body along with other symptoms. Currently, there are no specific laboratory or imaging tests for fibromyalgia. The main symptoms, pain and fatigue, are shared with many other conditions, so doctors typically try to rule out other causes for your symptoms. Doctors may do the following tests to diagnose fibromyalgia. Take your medical history. Your doctor will likely ask about the location, severity, and duration of the pain, and whether you have experienced severe fatigue or cognitive problems such as confusion or memory issues. They may also ask if you have other conditions, because some people with fibromyalgia have other diseases at the same time. And they will perform a physical exam. Your doctor will examine your joints to see if you have any other conditions such as rheumatoid arthritis or systemic lupus erythematosus. Causes pain in joints, multiple joints of the body. Your doctor may order laboratory or imaging tests to help rule out other diseases and conditions. What is the treatment of fibromyalgia? There is no cure for fibromyalgia, so treatment focuses on relieving the symptoms. Your treatment plan will likely include a combination of psychological and behavioral therapy, medications, and self management approaches such as physical exercises and other movement therapies like yoga or Tai Chi exercises. Cognitive behavioral therapy is a type of therapy called cognitive behavioral therapy which aims to change the way you think about pain, and it can be helpful especially when combined with other types of treatment. This type of therapy can be either one on one or in groups with a therapist. Other types of mental health counseling may also be helpful, and as far as medications are concerned, a number of medicines can help relieve the pain and improve the sleep quality. You may be prescribed more than one type of medication at the same time. Suppose antidepressants are being prescribed. Drugs that treat depression may also work for fibromyalgia, even if you are not depressed. Doctors may prescribe one of the several classes of antidepressant, including prothidine as well. And sometimes anti-seizures medicines are given. These medicines can lessen pain and improve sleep, such as lamotrigine, and they work by interfering with the transmission of pain signals to the brain. And analgesics are being given, and topiramate may be given, and they may be used for people who need additional pain relief. Anti-inflammatory pain medications and NSAIDs are usually not effective because fibromyalgia does not cause tissue inflammation, but they may help with other painful conditions that may coexist with fibromyalgia. So they aid in relieving the pain, such as indomethacin or diclofenac sodium and naproxen. You may need to try different drug combinations and dosages before finding relief from symptoms, and improvement is often gradual. Complementary and integrative medical therapies. Some people seek therapies such as acupuncture, massage, and hypnosis, but many of these have not been well tested in people with fibromyalgia. Before using these therapies, talk to your doctor about the best options for you. Who will treat fibromyalgia? Fibromyalgia treatment often requires a team approach, but it is primarily treated by rheumatologists who specializes in arthritis and other diseases of the bones, joints, and muscles. And fibromyalgia is not a form of arthritis, nor does it damage the bones, joints, or muscles, but rheumatologists usually treat it because the symptoms are similar to those of arthritis. Other healthcare professionals who may be involved in your care include exercise physiologists who are trained in understanding the body's response to physical activity, mental health professionals who may help people cope with difficulties in the home and workplace that may result from the medical conditions. A counselor trained in cognitive behavioral therapy can help you learn skills and techniques to better control the pain. Then pain management specialists who are trained in the evaluation of and treatment of pain. Physical therapists to improve quality of life through prescribed exercise, hands-on care, and patient education. And then primary healthcare providers including family doctors, internists, or pediatricians who coordinate care between the different health care providers and treat other problems as they arise. Then sleep specialists who address problems related to sleep, sleep disorders, and sleep health. And they prescribe you hypnotics. Living with fibromyalgia. Having fibromyalgia can significantly impact your quality of life and your ability to take part in everyday activities. There are things you can do to help you with the fibromyalgia, including exercising, educating yourself, and getting support combating fatigue. Exercising is a mainstay of therapy for fibromyalgia. Although pain and fatigue may make exercise difficult, it is important for you to be as physically active as possible. Research shows that regular exercise is one of the most useful ways to combat fibromyalgia, and even modest levels are helpful. Aerobic activity can also improve sleep and lessen anxiety and depression. You should start exercising at a low level and gradually increase over time. Low impact aerobic activities such as walking, biking, swimming, and water exercises are especially helpful. Activities that engage the mind and body, such as yoga and Tai Chi, are also helpful. Physical therapists or exercise physiologist can prescribe an exercise program and provide ongoing support. Be sure to check with your doctor before beginning an exercise routine. Then educating yourself and getting support. Learn as much as you can about fibromyalgia and join in online or in-person support group that includes others who are dealing with it, and having a support network can help you to manage difficult times. Visit a mental health professional if emotional problems arises. Research has shown that a type of therapy called cognitive behavioral therapy (CBT), which teaches skills for better controlling the pain, can be helpful. Then combating fatigue. Persistent fatigue is one of the most troubling symptoms of fibromyalgia. The following strategies may help you sleep better and feel more rested. Create a relaxing sleep environment and establish a sleep routine. Go to sleep and get up at the same time every day. Reserve your bed for sleeping. Watching TV, reading, or using a laptop or phone in bed can keep you awake. Keep your bedroom comfortable. Try to keep your bedroom dark, quiet, and cool. Avoid stimulants like caffeine and nicotine and limit alcohol intake. Wind down before bed and avoid working or exercising close to bedtime. Try some relaxing activities that get you ready for sleep, such as listening to soft music, meditating, or taking a warm bath. Pace yourself during the day. You may not be able to do all the things you once did, or not in the same amount of time. Try not to use up all your energy each day, because doing too much can make your symptoms worse. So this was all about fibromyalgia, and I hope so that this topic would be more informative for you, and I hope that you would have liked this video. And if you have liked this video, then don't forget to subscribe it. And thank you for watching and listening my video. Have a wonderful and nice day. Thank you very much.